Today I'm going to talk about pressure ulcers. Pressure ulcers are caused from unrelieved pressure, which causes ischemia to the skin and damage and necrosis to the underlying tissue. This is why a turning schedule is so important for your patients, and they need to be turned and rotated every 2 hours. So who's at risk? All patients are at risk that are immobile for any amount of time, either in a hospital bed or a wheelchair. They can have pressure ulcers. The clinical signs of pressure ulcer is the first one being blanchable erythema. And if the pressure is relieved, the wound can heal within 24 hours. The second is superficial abrasions, blisters, or craters. And those take 1 to 2 weeks to heal. The third is full thickness skin loss. And that will cause ulcers and deep craters, and that takes 2 to 4 weeks to heal. So the 6 most common locations for pressure ulcers is the sacrum, the coccyx, the greater trochanters, ischial tuberosities, calcaneus, and the lateral malleoli. So you need to make sure that those are either floated and rotated between, so not too much pressure is on any of those locations. It's also good to note that a pressure ulcer can feel boggy underneath the skin, so like a rotten apple bruise. That's how it will happen, and it's damage from the inside out. So pressure ulcers are staged from stage 1 to stage 4. The first one is non-blanchable redness, and that's a stage 1 pressure ulcer. Stage 2 is partial thickness, and that will be the abrasions, blisters, and shallow craters. Stage 3 is full thickness, and it'll have a deep crater with or without tunneling. Stage 4 is a full thickness, and it will have exposed bone, muscles, and tendons. And here's an example of a stage 4, right here in the center. You can see the bones. So what do we as PTAs do? Our clinical intervention, the most important thing is education. You need to educate the patient and the staff that their turning schedule is very important. You want to prevent these pressure ulcers from happening. So that you need to make sure they have the proper wheelchair cushions, multi-potus boots, floating the heels, teaching them wheelchair pressure relief, where they can either do the lat push-up and hold it for 200 seconds, or they can lean from side to side, or they can fully lean over to relieve the pressure. There's also pressure mapping that can be done to see if they have any spots that will most likely get those pressure ulcers. And if they already have the pressure ulcer, then as PTAs we have to do wound care management.